Thank you, candidate. For those of you viewing online or for those of you in the room, if you'd like to pose a question for the candidates, please use slido.com, and our code for slido.com is 24720. On to our next question. Vote Prosperity proposes that a national Pharmacare plan should use a gaps approach to get coverage to those Canadians who are underinsured or uninsured, rather than create a new bureaucracy under the National Pharmacare Program. Research has indicated that only 3% of Canadians do not have a healthcare program, and that's why we would ask for a gap approach to this issue rather than creating an entirely new program. Please tell us what your party's policy is around national Pharmacare, and we'll start with candidate Alzaba.
Thank you for that question. To be honest, we don't have a direct policy with regards to Pharmacare and building a Pharmacare plan. However, we do have a very unique and alternative proposal for our healthcare system. Now, with the understanding that healthcare is exclusively a provincial jurisdiction, that the past and current governments, federal governments, have been putting their hands into the healthcare cookie jar, we propose that rather than meddling with provincial jurisdictions, to allow for a small amendment on our Canada Health Act in order for provinces to have the option to add a supplementary private sector to their universal health care. This is this has been extremely successful in other countries where the option of having private health care allows to alleviate the lineups in our hospitals and allow for the health care to prosper and succeed for everybody to have access to health care. Now, especially with our universal health care, that is a pinnacle value in our in Canada, and we need to strive to protect it. And one of the options that we propose is to add supplementary private option in order to allow for everyone to have accessibility to universal health care or private options should they choose.
So candidate, how do you distinguish between a private healthcare option and the current private healthcare options that we have now?
Sorry, the question?
You're talking about supplementing, in Ontario, you're talking about supplementing OHIP with private plans?
Yes.
We already have private plans, so...
Or adding, having private plans, but creating an option in the Canada Health Act, an amendment to allow for provincial governments to take more control of their health care, and including and adding private hospitalization, for example, to allow for those who want to pay for private health care and private hospitalization, move away from the waiting, from the lineups in our universal health care, and make room for others who do not wish to take advantage or who cannot use private health care to have quicker access to our universal health care.
Okay. Open debate. Candidates who would like to weigh in on that? Candidate Ambler?
Frankly, whenever I hear Pharmacare and as a promise coming from the Liberals, I realize, it makes me realize that it is election time. I've been involved in politics for a long time, and the first time I remember this promise was the 1997 election. And I'm not sure how many times they've trotted it out, but it's at least 2 or 3. You know what? It's a complex issue, and it's going to take a lot of people at the table. I remember even in the 4 years that I was a Liberal, it wasn't a Liberal government. I was a Conservative MP under Stephen Harper, and it's very challenging. It's a very challenging file. Even negotiating things like bulk purchasing arrangements for drugs is very difficult because different provinces have different needs. And so, I think ultimately Justin Trudeau and the Liberals understand. They know that we can't afford Pharmacare. But I think what Canadians also instinctively understand is that it's because of the cost of servicing the debt. The Liberals have added in just 4 years $71 billion to the debt. They promised balanced budgets, and instead, they actually promised modest deficits, if you'll recall. Instead, we had reckless, runaway spending, and we're ending up paying now $26 billion a year servicing that debt. In just a few years, I think by 2022, that number is going to be $34 billion. That's as much as Canada spends in total on healthcare transfers to the provinces. So the reason why we can't afford something like Pharmacare is because of the way the Liberals are running this economy.
Candidate Alghabra, then candidate Hill, and then back to candidate Alzaba.
Thank you, David. We have been taking steps towards moving towards Pharmacare, a national Pharmacare. We have implemented bulk purchasing policies at the national level in working in collaboration with the provinces. We have also sent new instructions to the regulator that governs the pricing of drugs by adding countries that have drugs that are less expensive and removing countries that have some of the most expensive drug prices in the world to ensure that we have more competitive drug pricing. Those steps move us towards having more accessible, more reasonably priced drugs. And our platform has a commitment for a national Pharmacare. The details of it need to be, as Hazar mentioned, need to be worked out with the provinces. But we have done our homework. We have consulted experts. And now the hard work will also be required to work with provinces on designing a Pharmacare, a national Pharmacare. And I look forward to achieving that under the next mandate.
Candidate Hill.
I don't know that we do have the highest drug prices in the world. I seem to recall reading an awful lot of stories of Americans coming over the border to buy their insulin here, so.
No, I didn't say we have the highest. I said that we removed one of the countries that has the highest, which is the U.S., by the way.
Whichever, though, it should just appall everybody that in a country as rich as ours, there's a substantial part of the population that can't afford medicines. And this is something that needs to be corrected. So the Green Party does propose a universal Pharmacare single payer system here with a 2020-2021 commitment of $26 billion to introduce Pharmacare for everyone. This will improve not only the health of low-income Canadians, but their economic well-being as well.
Candidate Alzaba.
I just wanted to add to candidate Ambler's comments, which I agree with, and it goes back to the Liberal government wanting to promise a universal Pharmacare, and this promise has been done before time and time again, and the issue now that we stand is how do we afford that? They want to promise to invest $6 billion in Pharmacare in the next 4 years, universal Pharmacare, when we can't even balance our budget. So what I see happening here is the Pharmacare program collapsing, maybe not in the next 4 years, but collapsing in when we go into a recession. And I use when because we will go into a recession if we don't tackle our imbalanced and irresponsible budget at the federal level.